webinars, and for having the ability to work with the Department of Human Rights and um, to be able to have these presentations that are so important. I'm beyond grateful for that. I've been able to personally work with Chantel in the past, and I just appreciate all her guidance in the past. So I'm very excited to hopefully help and assist in returning that opportunity. I also would like to thank Mary Peterson, who has been wonderful to work with as far as getting this set up for you today. And the other two people that I would like to thank are the interpreters, who are Carrie Wood today and Tar Von Walden. One of the offices that I manage is Deaf Services, Deaf and Hard of Hearing Services. And so since COVID, we've been learning a lot about how to do video and audio, video presentations. And no two platforms are the same, but by and large, the deaf community and hard of hearing community finds on a local level, state, and national level when surveyed that Zoom is the preferred platform. But when recording a Zoom video, it can be different than a live video. So we appreciate your patience today in setting that up. But if you haven't had the opportunity to have interpreters present and to interact with the deaf community, I'm so glad that you're getting that opportunity, because it's so important to be inclusive to people who are deaf and hard of hearing. And on that note, I'll go ahead and give a short introduction of myself. As Chantel mentioned, I'm Jill Fulitano Avery. I have been with state government for over 18 years now. I have always been in human rights. That is my home. That's where I love to be and want to hopefully retire from. I originally had the Office of Deaf Services, and then later I was appointed the Native American Affairs Office. And then after that, I acquired Deaf and Hard of Hearing Services. I am a person who has multiple disabilities and hearing loss myself. And as we were getting things together today, I was saying that my neighbor is having some construction work, but I do know some sign myself. So I will be looking at the interpreters at times too through the presentation if I'm having any challenges. So I also have a deaf dog that sometimes makes a little cameo appearance. So just wanted to make sure I said that. Sometimes it's less distraction if I just leave her in. So anyway, just wanted to tell you that on a side note. One of the things that I very much enjoy is the intersection of all of those communities. Also, for a short time, I was the acting administrator for all of the 7 advocacy offices in human rights. Was asked to do that permanently, but I really love working directly with the community, so chose to continue to work with the 3 communities that I'm working with now and more on a daily basis. So that's a little bit about me. I would like to also thank our panelists today. We have a stellar group of women with us. One good thing about having a disability, or more than one disability, as I said, is that you get to meet people that you would never meet otherwise. And so I have been very blessed to get to work with the 3 women that will be self-introducing themselves in just a moment. Those women are Brooke Lovelace from the Iowa Developmental Disabilities Council, Cindy Miller from the Disability Rights Iowa, and Terry Jorgensen, who is one of our commissioners for the Iowa Commission of Persons with Disabilities. The Iowa Commission of Persons with Disabilities is a commission that is associated with our office. Of the 7 advocacy offices in human rights, each of them have constituent-based gubernatorial appointed commissions. So Terry is one of those people that will be speaking today. Each one of these women bring a wealth of knowledge and background, and so you get to hear many, many years of experience today from their perspective. What I will be doing is having them, like I said, do a self-introduction, calling on them, and then I have about 5 different questions that I will be asking each of them. And then, as Chantel had said, you will be intermittently or at the end asking questions. And so I'm excited to get started. So Brooke Lovelace, if you will please introduce yourself, that would be wonderful.
Good morning. Thanks so much, Jill, and thanks to the Department of Human Rights and to the AG's office for inviting the DD Council to be a part of this panel and this really important conversation. I think it's important that the DD Council be a part of these conversations when we talk about our older Iowans, whether they be folks with disabilities or folks without disabilities. So we're real excited to be here. I did want to take this opportunity to talk a little bit about the DD Council, just in case there's some folks that may not be as familiar with us. And I'm going to hopefully here, if technology will help me, share my screen. Hopefully. Somebody wave at me or say something if you can't see this, but it looks like we're good. Don't hear anything. So just want to give a little bit of background. The Iowa Developmental Disabilities Council is authorized through the Developmental Disabilities Assistance and Bill of Rights Act that was last authorized in 2020. And what that act did was it set together some programs to help improve the lives of people with developmental disabilities, doing that through capacity building, systems change, and advocacy, and also the enforcement of protection of civil rights. And I think those advocacy and systems change and capacity building mandates will come out a little bit more when we get to our discussion questions that we have today. But so these programs that were created were the DD councils. There's one in every state. The Disability Rights Center, which is Disability Rights Iowa today, which we're excited to have Cindy be part of this panel as well. And then the University Centers for Excellence in Developmental Disabilities, which is in Iowa, the CDD. So funding for these programs comes from the federal program that's called the Administration for Community Living. So we're a small staff. There's just the 3 of us. There's myself, and then there's Bill Kalstead, who's our new public policy manager. And then we have an administrative assistant that helps keep our office somewhat sane. But just wanted to give a shout out to our council members. These are the folks that actually guide the work that we do. There are 24 members and they're appointed by the governor. And it's really important to mention that 60% of them have to have either a developmental disabilities or be a family member, caretaker of somebody that has a developmental disabilities. And then we do have some mandated state agencies that also have to be part of our council. And one of those is the Department of Aging. And then we have Department of Education, Disability Rights Iowa, the Center for Disabilities and Development, VR, Voc Rehab, and then somebody from the Medicaid department. And so, like as I mentioned, these are the folks that help guide our work. So it's actually who I report to. So that's a little bit about our council and our staff. I do just want to point out just a couple of our resources that I think are intersectional that help folks with disabilities and our older Iowans. And that's our Infonet. And for those that may be listening on the phone, I'll just read out that website here, but it's www.info.org. That's our publication that talks about what's happening with the legislation, and I'll show another slide here next. And then I also want to point out our other program that's helped to folks be more civic and politically engaged, and that's our ILAST Disabilities in Action, and that's you can find that at idaction.org. So this is just a screenshot of what our Infonet publication looks like. And as I mentioned, so this is a website that we have. We also are on social media, and then we actually still do hard copy mailing of this. And so this helps keep people informed of what's going on both at the state and federal level with legislation. So if there's certain bills that affect folks with disabilities, older Iowans, an intersection of both, we track those for folks. And so they can stay informed about, you know, if it's something that they're concerned about, something they care about, they can contact their legislators, and we help assist them with doing that and crafting messages on what to say if it's something that they're concerned about. And so this is obviously more in use during the legislative session, but we do also inform folks throughout the year with things. And so I do encourage you, if you're an advocate in any way, or a person with a disability, or one of our older Iowans, to do get signed up for this so you can stay informed about what's happening both at the state, local too, I should mention, because, you know, it's also important for people to be civically engaged in what's happening in their local community. And this is a publication that helps folks do that. So do get signed up for that if you're not receiving that currently. And then just another one of our publications, or something I just wanted to point out, that's through our Isms and Disabilities in Action, which again is a resource to help people stay civically and politically engaged. I'm sure you'd have to be under a rock right now if you don't know that we have an election that's coming up here in a couple of weeks. And so we've tried to put together some resources for folks, and this is just an example of one of them, just to make sure they know, you know, what's going on, what some of the dates are for voting, how they get registered, where they go to find out information, what the important dates are about when they need to be registered, which I do want to point out that if you're not registered to vote, you do need to be registered by this October 24th. You can register at your polling place on the day of the election, but if you want to be registered to vote and want to request an absentee ballot, both of those things need to be done by the 24th. So this is, again, just something else that we put together to help keep people informed of what's going on, and encouraging people to get out there and vote. So those are just a couple of our resources I wanted to point out. And then I have my contact information. You can find our website. It's iowaddcouncil.org. And then my phone number is 515-288-0442. And now I think we're turning it over for Cindy for introductions. I'm going to stop sharing. Jill, is it Cindy that's speaking next?
I think so.
Thank you so much, Brooke. And Cindy, good to see you today. And if you'll please go ahead and introduce yourself. Thank you.
Well, good morning, everyone. I'm Cindy Miller. I'm an attorney and the legal director with Disability Rights Iowa. As you just briefly saw on Brooke's PowerPoint, we are an agency that we're a nonprofit agency, but we use federal funds to support our advocacy and our legal services. One of those funds that Brooke just highlighted was the Developmental Disability Fund, which supports our work with individuals with developmental disabilities. We have 7 other grants that assist us in our work, from mental illness, voting, Social Security. We do a lot of different types of work on behalf of people with disabilities, from abuse and neglect investigations and monitoring of facilities to accessibility of locations. You know, when you hear the word accessibility, you usually think like, can I get into a restaurant? Are there steps or something? But it also includes things like, can I access different programs? Jill mentioned the platform, the web platforms, and are they accessible for people who are deaf? Those type of activities we work with. We also do work with assistive technology, Medicaid, healthcare issues, juvenile justice, employment. We discuss guardianship issues, housing, juvenile justice. And then one of the things that I'm probably going to highlight a little bit today is what we refer to as community living, and which will become really important with individuals who are older, because we have a lot of Iowans in nursing facilities or different type of facilities around the state. So we do a lot of work to look at how can we have more support in the community to keep folks in their homes longer than going straight to nursing facilities, which will have some unique experiences that we can talk about today. We have a staff of 19 individuals. Some are in management, others are lawyers. And we also have some advocates. We have benefits planners who do some work with Social Security and helping individuals return to work. We're small but mighty. We represent individuals of all disabilities and all ages, so from birth to death. So we pretty much cover a large gamut of individuals, and we're happy to be here today.
Thank you so much, Cindy. And next, I would like to introduce Terry Jorgensen. Terry?
Hi, guys. Thank you so much for having me. I'm Terry Lynn Jorgensen from Waterloo, Iowa, and I really, really appreciate everyone taking the time to discuss this very, very important issue. As we all know, a disability can happen to anyone at any point in time in life. It may not have affected you personally yet, but you could have a family member, or like myself, I was born with spina bifida on a very, very, very cold February night in Cedar Falls, Iowa. Came into this world butt first. So kind of screaming and kicking, born, raised in Cedar Falls. I do serve on the Iowa Human Rights Persons with Disabilities Commission, and very honored to serve on that, as persons with disabilities are often underrepresented and very often not heard. I'm also the vice chair of the Cedar Falls Human Rights Commission. I am vice president of the Waterloo Housing Trust Fund, also co-founder of Cedar Valley Rollers, which supports persons in the Cedar Valley, Waterloo, Cedar Falls metro area, wheelchair users and those that love them. So that's very cool. I do own my own business, Terry Lynn Productions. I am a voiceover artist, a 37-year radio veteran. So I am using this voice, hopefully in a positive way. I can be a little sarcastic. I like to deal with things with humor, but I've done radio for over 37 years to get the word out, and have been doing some things, but we definitely need to kick a lot more things into high gear and be thinking about the future and to be proactive instead of reactive. So thank you so much for having me.
Thank you for your introduction, Terry. And again, we are just going to go in the same order for the questions. Brooke will go first, and then Cindy, and followed by Terry. I have several questions, and the first question that I'm going to ask you to answer is, what are the unique strengths for elder care for persons with disabilities?
Thanks, Jill. This is a good question, and hopefully I'm going to answer this in a way that makes sense for folks. So as I mentioned earlier, the council is charged with advocating for people with disabilities of all ages, so people can live and, most importantly, remain living in their communities. This isn't a surprise to, I'm sure, the folks on the panel, but people with disabilities are living longer, which that's a good thing. And more are doing so in their homes, which is also a good thing. But what's happening as well is that caregivers are also aging. What's an interesting opportunity is that we're now seeing a trend where people with an intellectual disability or developmental disability are also caring for their aging parents. And so there's some unique things that can come with that. just being part of that caregiving towards the end of life type of thing for a person with disability to be involved with and be part of that family circle. And so that's an opportunity I think that we can look at through our state, is how we can help that relationship and that to continue to happen. So then it's also important that our local and state and federal policies and funding are there to help give people with disabilities and their family members the tools that they need, so they can continue to live in their communities. And that's a part where the council can come in and help folks advocate for what those policies, what the funding is that needs to be, so we can make sure people can continue to be able to have the lives that they want in their communities.
Thank you so much. Cindy?
Well, I'm going to do my best not to repeat other speakers today. So I'm going to choose a couple different things from what Brooke said. I think one of our strengths in Iowa is that we have a robust group of agencies and individuals who are advocates that work on behalf of not only people with disabilities, but also older Iowans. I think one of the things we need to work really hard in doing is making sure we all know who we are so that we can connect with each other. I know that I've collaborated with many of you on the participant list here today, and we can't do our work without reaching out to others and building on what each of us brings to the table. So I just think we have a good body of people that are willing to advocate for individuals in Iowa, and we just need to keep building on that. I would also say that I think especially in the digital age and the way we're all moving with technology, there's a lot more information about civil rights and individuals' rights out there. And I think individuals with disabilities and older Iowans are becoming more educated about what their rights are, which is empowering them, which is a great thing. As the election is coming up, there's so much information out there about how to vote, how to exercise your right to register. If there are individuals within a facility, they have rights. If an individual has a legal guardian, they still have the right to vote. So I think we're doing a good job of trying to get out all those education materials on different types of civil rights topics, and we can really work together and build those bridges on the foundations that are already there.
Thank you, Cindy. And Terry, can you respond, please?
Well, actually, the two former ladies have basically summed it up for me. We just are doing some great things and want to continue to do those great things and make sure that everyone, no matter race, color, gender, sexuality, ability, non-ability, that we are all at the equal starting line, not the finish line. So we got to have the opportunities for all. So we've got a lot of work to do. We've come a long way, but we got to keep going and keep pushing, and we have to do it daily.
Thank you, Terry. And the next question that I have is, what are the unique challenges on the other side of the flip side to the question? So what are the unique challenges for service providers or recipients of persons that are elder with disabilities or with elder care? And if you'll go ahead and start, Brooke, thank you.
Sure, thanks. As people get older, whether they're a person with developmental disability, a physical disability, or a person without a known disability, your needs are going to change. How your plan of care might not look the same every 6 months. It needs change. And I think Terry explained this. I think we do have some work to do. I don't think our community capacity is up for some of the challenges that may come for this. Dementia is 5 times higher for folks with ID or DD right now than when it was 20 years ago, because people are living longer. And most caregivers and family members The most recently I think I saw was 2.9 million are family caregivers, and most of them are unpaid. And then so there's some financial situations that go there too. We're also seeing an increase in siblings as family caregivers who, will have families of their own and have full-time jobs. And it's hard to provide care for a person with a developmental disability and possibly aging parents as well, and try to do homeschooling and work in this new virtual world we have. So there's a lot of community capacity challenges I think that we need to address. And I think, I think this is a great conversation that starts that, that I guess starting that conversation going forward is, how do we, now going through this pandemic, we've even seen that there's some unique challenges and some unique ways to meet those challenges through the ways that we've been able to cope by doing things more virtually. And so I think just coming together with the group of folks that we have today on how we address those challenges is where's the key at, where we start.
Thank you, Brooke. Cindy?
Well, unfortunately, this is my biggest list on the questions that Jill gave us. So I'll try to be brief, but I think there are a lot of challenges that still exist for individuals with disabilities and older Iowans. And I think that the pandemic has only highlighted systems issues that were already in existence, but just kind of have floated them up a little bit. Right off, one of the main challenges that I think anyone that we serve faces is they are usually involved with very large systems such as Social Security, Medicare, and Medicaid. And just those systems by themselves are very difficult to navigate with a lot of the jargon and the technical things that you have to do in order to not only apply for services, but maintain those services. And I think it's hard for individuals to know, who do I go to for some advocacy to really walk me through those. So we need to probably work a little bit more on trying to get individuals connected with people that can help them navigate those very large systems. I think with the pandemic, we really have seen an increase in isolation of individuals, obviously for safety purposes with the virus, but that isolation also has the dark side, so to speak, where individuals may be at home, don't have digital access, similar to those maybe of a younger generation. So, I was thinking last night as I was watching some network TV, how awful it would be if I didn't have access to things like Netflix or Hulu to take a break from the barrage of political ads that you get every single night on TV, and just how that kind of just makes you feel every single night. So I was just imagining if I was an older adult who didn't have any internet access, and I'm not having visitors come into my home, just what that would feel like, and what are ways that we could make that better. So, one of the things that I'm going to talk about maybe in changes is making sure that all generations have equal access to things like technology, internet, those type of things to help expand and eliminate some of that isolation. I also think that the pandemic has really highlighted ableism and ageism together. And one of the things that I recalled at the beginning of the pandemic is when we started to report numbers of individuals who were getting sick or who had died, they would list what the age group was of those individuals. And if we all remember, the information that was coming out at the very beginning of the pandemic was that this virus was most harmful to the older populations. And I think how many of us that are not in that age group went, oh, okay, good. I'm not at risk. We've since then had a lot more information come out that makes things, we all have more knowledge that that's not true now. But I think that kind of highlighted that ableism of we are willing to let a group of really vulnerable people go, so to speak, or we think it's okay or commonplace that our older Iowans can get the virus and die, so long as younger generations don't. And I don't think we're all that callous, and I don't mean to speak so negatively about it, but I think it's been highlighted For example, we have a lot of individuals in different types of facilities that obviously had to have safety concerns by restricting visitors and eliminating the traffic that was moving in and out of facilities. But what happened then is we had individuals who are now very isolated, don't have community contact, don't have loved ones with them if they do get sick, but we have staff that can travel in and out and are exposed to different risks in the community. And we've seen that it's just been a really unfortunate situation for individuals, especially in nursing facilities. The other thing I want to highlight is different states and different hospitals or organizations have what we call crisis of care standards. And we're seeing some discrimination within those standards that have a hierarchy of who can receive different types of life-saving services. So for example, there's a state in Southeast United States that had a very discriminatory policy that basically said, if you're an individual with a disability, you are low on the totem pole to receive ventilation if ventilators become scarce. Thank heavens we haven't found that blatant discriminatory language in Iowa policies, but we need to be really careful about making sure that there's equal access for different types of medical services for those who get sick during this pandemic. I'll stop there and let Terry talk.
Wow, lots of overwhelming stuff. Personally, for me and for others, our system is so broken and is so overwhelming that it's so hard to navigate, get frustrated. One thing may cause you to be eligible for a great service, but then something else makes it so you're not available or able to receive the service. So it's very confusing. I think it needs to be restructured and really, really gone through on what is it actually that we're serving and does it make sense? And so that system is just so overwhelming. The knowledge for persons with disabilities, the information isn't there. As I said, I am a 37-year radio veteran, and it wasn't until probably about maybe a little less than 15 years ago, I was informed about the Medicaid for employed persons with disabilities that is in the state of Iowa. And I had no idea what that was. And I worked just to pay for health insurance. My health insurance policy was close to $1,200 a month. $1,200 a month. And I was basically working just to make sure that I had insurance. Then all of a sudden I found out this Medicaid with employed persons with disabilities. And lo and behold, my insurance policy went down to $25 a month. That's huge, huge. So the system is just, it's very overwhelming. We need assistance on how to navigate the system and what is available out there. And basically kind of like a one-stop shop, because people may think that, oh, well, you're in the system, you know. That is not the case. And not all persons with disabilities are in the system. A lot of us are not. But then all of a sudden, we need the assistance, and we do not know where to turn to get that assistance. Another thing that I feel strongly on is accessible transportation, and that is 24 hours, 7 days a week, 365 days a year. That is covering a good bus system whether it be taxis, Uber, Lyft, whatever it is, but it must be accessible for all and affordable. Affordable is a good key. So my big thing as a person with a disability, as I age more, I would like to think that I can keep going, but on a daily basis, you know, things really change. And something that maybe I was able to do for myself last week, all of a sudden is getting very difficult for me this week. For example, I am starting to find out my dexterity. I'm really losing my dexterity and dropping things and forks, knives, feeding myself type things that were never, ever, ever a concern with me. So caregivers to come into our homes and help us is crucial. And the pay for those that are coming in to help us is so low that it's not worth their time to they're not getting paid enough, basically. And they want to do it out of the goodness of their heart, but they need to be paid as well so we can continue to get good care. Unfortunately, I have had a few friends that have died due to the lack of quality care. They could not find a good caregiver because of the pay rate. And that's devastating. That's devastating. I fear that. And I fear not being able to stay in my own home. I worked so hard to establish what I have gotten so far. I want to remain here. I do not want to be institutionalized. That's my biggest fear in life, is that the brain still works. And of course, the sarcasm still shoots out of the mouth, but the body doesn't. And I'm going to need someone to take care of me. And where am I going to get that care? It's scary. I'm 55 years old and I'm scared. I'm very, very scared. So the assistance is huge, just huge, along with the transportation and the funding for it. A lot of people fall in between the cracks, myself included. And what I mean by that is, do I go to work and make $15 an hour, which isn't, bad. But if you're working 20 hours a week, can you live off of that? Or do I totally not do anything and remain on the system, receiving Social Security, disability, SSI, and that? Because if I make just a little too much money, I'm kicked off of all of those services. That's difficult. That's difficult. Right now, and it's just a matter of dollars. In $20, $30 can get you removed from the system at the drop of a hat. That's got to change. Thank you.
Wow, Terry, I just want to thank you so much for not only highlighting some of the unique challenges, but having the power, bravery, and vulnerability it takes to share your personal testimony to those experiences today. I so much appreciate that, and I'm sure those that are listening appreciate that as well. For our next question, it's similar to the last question, but it gives the panelists an opportunity to provide any additional insight that they may have. And that question is, what changes would you like to see if you had a magic wand? However, I think the panelists are in a sense our magic wands out there working very hard every day to advocate for these changes. What would you like to see change? And again, it's similar to the last question. We did hear some of that, but I'd like you to also have an opportunity to expound on that. So if you would please speak to that, Brooke.
Thank you. And geez, Terry, thank you for, I echo what Jill was saying. I mean, it just does not get any more real than how you just explained all of that. And I mean, it's just to change the system would be to fix everything that Terry just talked about, because that, again, is just so real. I mean, a couple of things that, you know, we've been working on, and it seems like we've been working on them for a few years now, is that, you know, we need more funding for home modifications and safety modifications in the home so people can, again, continue to remain in their homes. And the DD Council, along with all the partners here today, have been part of the Livable Homes Coalition now for, I think, the last 5 years, and then put in legislative requests to get more funding in for these types of things, and it's just not gone through. In addition to that, we need more assistive technology, and not to keep going back to the pandemic, but I think that's been shown more through the pandemic, with people not having internet access in rural areas. And sometimes even, I live in Newton, Iowa, and I have to have the IT guy come out today in my house to upgrade my speed for like the 100th time today, just, you know, so I can work at home, you know, and I'm in Newton, so it's not that rural really. You know, because I think one of the things that has shown that it's worked is telehealth options for folks. And I think we need to increase and continue those opportunities for people, especially when transportation is such an issue, and some medical needs and mental health needs can be met through telehealth options. So I think, you know, when and if this pandemic is over, I think we need to make sure those options are still available for folks. And that they have the IT and the assistive technology to be able to participate in those telehealth options. Some of the stuff that Terry talked about, I mean, the system is ridiculously hard to navigate. The amount of paperwork that you have to do in order to access services is just too much. And then when your services are denied, going through that whole appeal process, people just give up. You know, and that's frustrating for, I think, everybody that helps advocate for folks, is because they just don't have the information about how to navigate through the system. And then when it's not working, what do they do? So, I mean, I guess those are some of the things that I'd like us to see us work on. You know, I think too, we talked a little bit about this. I think it was Cindy's, you know, the social isolation. That's also really a real hard thing for people to have to cope with. And so I think we need to somehow figure out how we can do more peer-to-peer opportunities for folks, especially if they're caregivers that, you know, are not leaving their home because they're caregiving for a loved one. And so there's no interaction there. I mean, there's just tons of opportunities I think we need to look at to see how we can help that social isolation piece. And then also, you know, during this pandemic, provide some respite options for folks, so that they're not completely as overwhelmed as individuals have been. I mean, you could go on and on for this on what needs to be changed in the system, but I'm sure Terry and Cindy have some more things to add.
Thank you, Brooke. And Cindy?
Well, the first thing I would do with my magic wand is I would take all the millions of dollars that are spent on TV ads in Iowa for political purposes and dump it into Iowa's direct care systems, our Medicaid system. And I would just beef up everything that we need to serve people in their own homes or in facilities as best as we can. What I find interesting that every single one of us have in common is every single day we are aging. We are all getting older every single day, but we don't seem to put emphasis on what do we need in order to meet those needs as we get older. Or alternatively, we will gradually gain disabilities or different type of medical diagnoses as we get older. So why aren't we making our systems friendlier to the idea that every single one of us is going to need a service at some point in our life. So some of the other things I'd like to see, a little bit of a less siloed system. We're all experts in our own area, but we really need to pay attention to intersectionality. If you take all the different webinars that this group has already done in the last couple of weeks, I think you could see that it's not just an LGBTQ person, or it's just not someone of the Latinx community, or it's not just a person with a disability. You could be all of those things, and then add on women's health issues or men's health issues. We're multi-layered people, but we sometimes seem to treat our problems in a very siloed way. And I don't think that's effective overall. And we need to learn how to build our systems to be a little more communicative and really address the whole person and not just pieces of ourselves. I would also just, outside of the pandemic, talk about accessibility in general. As we get older, or as people with disabilities encounter different health systems, things that would be very helpful, such as a hospital bed or an exam table bed in a doctor's office, that would maybe lower or move upwards, instead of us all trying to get on that awkward step and get on that table. I think we need to move our not just assistive technology, but our devices that we use every day need to be a little more accessibility friendly as we all get a little bit older in our lives. And I'm going to echo Brooke, and I'm going to echo Terry. One of the biggest needs we have is to make sure that we have adequate in numbers, but also in quality of home care workers for individuals to maintain their lives, and not just living in your home, but quality of life in your home. That's so important to all of us. But I don't know why, for people with disabilities or older Iowans, we're easily dismissive of that quality piece for them. So we really need to not only figure out a way to get higher paid individuals in there, but make it just a more enjoyable experience for everyone. Respite was mentioned. All these things are just so important for us to just maintain a good quality life. Maybe I'll leave it there, but a pandemic related issue is we have got to dump more resources into having appropriate protective equipment for our staff that work with individuals with disabilities in facilities and in those home care settings. We've got to have adequate testing, and we've got to have a system that will not only be able to take those tests that we have and make sure that we've got a system that can process those tests. All these things have been highlighted, unfortunately, in Iowa over the last 6 months. And I think when this pandemic is over, I don't think we should just put it on a shelf and walk away. I think we need to be working every single day to make sure that we're ready for the next pandemic also.
Thank you again, Cindy. And Terry, what would you like to add?
I would like to add, it's not a Republican thing. It's not a Democratic thing. It's human. We're all involved, regardless of if we're Republican, Democrat, green, brown, white, yellow, red. It's human. And there are humans that are losing their lives and having things affected. And just keep in mind that that could be you at any point in time in life. How would you like to be treated? How would you like your child to be treated? I am definitely going to echo on the accessibility of our hospitals. As a 55-year-old female, it's very, and a wheelchair user, it's very, very difficult to get a mammogram. Didn't really think a lot about it until we went to do it. And it was a painful situation for not only myself, but the technician as well. We've got to be open-minded and be thinking about removing any barrier, even just an inch. And educate educate, educate. Accessible housing is non-existent, and I don't understand why. I don't understand why we are not requiring new builds be built wheelchair accessible from the get-go. People like to say, oh, it's so expensive. It's so expensive. The afterthought is expensive. From the beginning, it's not. Put a little extra support in the wall. Make sure that your doorways are always at least 36 inches wide. Second and foremost, that needs to be done throughout places to shop, to worship, to live life. Because just because I'm in this wheelchair and have a disability doesn't mean that I'm going to stay at home, sit home and cry and not do anything. But I tell you what, the frustration and the really making someone feel about this big is when someone says, well, you know, we don't have your kind come into our business that often. They don't think about it. As you can tell, it's very hurtful. Very, very hurtful. It's going to take all of us, not just persons with disabilities, those of us that don't have disabilities or different abilities, color, sex, you know, just all of it, straight down. If you see something and it makes you uncomfortable, say something. With the internet and that, people are starting to really experience some of these things that have been happening for years and years and continue to happen, but they're actually seeing them for themselves on the internet and can't believe that things like this have happened. I'm here to tell you, I've experienced it personally more than once, and I'm tired. I'm tired. I'm almost tired of fighting. And we need to make change. I want to make a difference. You can make a difference, but we have to do something. We can't just talk about it. We have to make the steps and move forward and take action now. Thank you.
Thank you, Terry. Although just thank you sounds a little trite, but we're going to move on to the next question. And I really enjoy this question. What particular accommodation or accommodations have been helpful for persons who are aging or persons that are aging with disabilities? And Brooke, will you start us out again, please?
Yeah, thanks, Jill. I mean, I think some of it that we've already talked about. I mean, I think home modifications is something that we've shown that has been effective in keeping people home and cost effective as well. You know, I think that we can also look at too, again, I keep going back to the pandemic, but that telehealth has really worked, and there's stories about how that's been successful. You know, one of the things too, I think, you know, as people age, whether it be people with or without disabilities, folks are also working longer. And, you know, I think that we've shown people with disabilities have been asking to be able to work from home for years and years. And there's always been a barrier about, oh, we just don't allow that at our company, or we can't have that at our company, you know. And now that we've shown that we actually can do that, you know, 99% of the jobs can be done at home. So I think there's still some employment opportunities for folks that want to continue working that need to be looked at and explored. You know, I think we need to look at other options for transportation. There's some states that have figured out successfully how to use our Uber types of transportations that are out there and make it work. Those are just some of the things that come to mind. And I'm sure Terry and Cindy have more to add.
Thank you, Brooke. Cindy?
Brooke actually took a couple of my ideas. I was going to highlight employment. You know, people are working longer, and there are great opportunities to do that in healthy and careful ways to meet their needs, whatever it may be. The teleworking has been obviously popular the last 6 months, and we've seen some issues starting to crop up as employers would like employees to return to offices, and how can you accommodate individuals who maybe are still vulnerable to the virus and maybe need to expand their telework at home. We've had all kinds of different employment accommodations. And the one thing I'll say in a generalized manner is when an employee asks for an accommodation, I wish that employers wouldn't immediately go, like, oh my gosh, it's going to be super expensive. I don't know what we're going to do. An accommodation can be very, very simple at times. It could be something as simple as the bus picks me up at 8:30 and my job is 8 to 5. Could I move my hours to 8:45 to 5:45? You know, it doesn't always have to be a financial or a fiscal attachment to the accommodation. So just, it would be great if employers would keep that in mind. I've already talked about physical access to hospitals and doctors' offices, but Terry said it best. You know, if you're going to have a new build, make it accessible right away. We've got a lot of new hospitals or different types of even office buildings being built all the time in our communities, and it should just be built accessible right from the get-go. Then there's also just little things that people don't think about, such as accommodations during the pandemic for someone who's in a facility. Let's say that there's an individual in a nursing home that has communication issues or maybe is nonverbal, but they have a provider or a loved one who has worked with them every single day and knows how to relay their communication. There are ways to request a reasonable accommodation to provide that service that gets around those no visitation or no visitor policies. So there's some really creative things that people can do to make sure that we're meeting individuals' needs where they're at.
Thank you, Cindy. And Terry.
Well, when we talk home modifications, we really need to increase our funding for that. And on some of the waiver programs, a lot of times with that, you can get it one time. So if you need a doorway widened and you use your dollars for that, that's it. You're done. Now all of a sudden, maybe you need your kitchen remodeled or a bathroom or whatever, and you can't get assistance. And when I'm talking about assistance, it's not much. For instance, if you were to need your doorways widened to get a wheelchair through, your assistance that you may get may be $500, but the job actually costs $2,500. Where are you going to get the rest of that money? As a person with a disability on SSDI, I can't have over I cannot have over $2,000 in assets. I can't have a savings account or save for a rainy day or save for that modified bathroom that I may need that is going to be about $25,000, because that could set me over the limit and I'm kicked off for good. And then I have to start over again. It's scary. It's scary. It really, really is. And I would like to kind of expand on the work accommodations. Tell you a personal story that people have a hard time believing. It happened. I actually have lost 2 jobs due to medical. having to have a medical procedure or a surgery. Sorry, we can no longer keep you on the payroll. Places that I've worked at for 15 years, almost 20 years. I've also experienced asking for accommodations to the point where I practically had to beg. I worked at a job where the restroom was not wheelchair accessible. I could not use the restroom to work. Asked for accommodation to make it wheelchair accessible. It took almost a year, about 9 months to be exact. Monday through Friday, I went to work for 9 months and was not able to use the restroom. Think about it. We got to change. People, we got to change. It's happening, and it continues to happen day after day after day after day. Listen to our stories. Hear us. Make a change. Please, please. This may not affect me in my lifetime, but it's definitely going to affect my goddaughter, my family, my friends, and their children. Don't make them struggle like a lot of us do on a daily basis. We've got to make some change. Reach out, ask us, get our personal opinion, roll a day in our wheels, or how we live our life. Let us help you and make a change and make it better for all. Thank you.
Thanks again, Terry. And the last question I have before we get to any questions that I have, it's an opportunity to the panelists to have a chance to just say anything that they would like to say that maybe they haven't had a chance to express, or what they think is important for our audience to know about. And again, we'll start with Brooke.
Thanks. You know, I don't want to sound like a broken record, but I do think that we need to keep advocating and having these conversations at the local and state level with our legislators on how the system is so broken and that how it needs to be fixed. And I think just even sharing Terry's story is a good example of what needs to get out there. And it needs to be more than just people with disabilities. You know, we need to be going to our, our chambers of commerce and our city council meetings, as well, and hitting things at the local level, because it's not working either at the local, state, or federal level. I mean, that's obvious. So we've got to just keep advocating. The council tries to be an entity that folks can use to get people the resources and keep them informed on what they need to know. We need to do better at that. And so, how the council can get there and help people better advocate for their needs. We'd love to hear those stories. But yeah, I mean, we just have to keep fighting and having these conversations and not giving up.
Thank you, Brooke. Cindy's ready.
I'm just going to echo the same, at Disability Rights Iowa, along with DD Council and how Terry advocates on the commission, we're stronger together. There are laws out there that are not being followed and upheld, and that's our job to hold people's feet to the fire and make sure that there is compliance. But the other piece of that is what happens when everybody's in compliance and it still isn't meeting our needs. We have to learn how to negotiate and push the envelope to get new laws and new civil rights for individuals. And, this summer we've seen a lot of really good advocacy pushing the envelope in other areas, and disability rights and older Iowans need to have their seat at the table too. It's very important to make sure that movement doesn't get stalled and that those voices rise up higher too.
Yes, thank you, Cindy. And Terry?
Great job, ladies. It takes everyone. And we need to do this together, come together and do it and think of others. As I said, you could be in this situation at the drop of a hat. And I've seen it. I've seen many different people come out of rehab units at the hospital, broken necks, paralyzed, strokes, and their life just changed in the blink of an eye. And they're like, "Now, what do we do now?" I live that on a daily basis. What do I do now? I keep pushing forward, but we got to make a difference. We have to. We have to come together and help each other, especially in our mental health. I have recently been working with the Cedar Falls Police Department, doing some implicit bias training. And what I'm hearing so much, are the calls. About 90% of the calls that they are receiving are for persons that have mental issues. And they try to get them the help that they need, get them to the hospital, and then to turn around and find out that there isn't a bed for them, there is no place for them. So they're released back out into where they came from, whatever. And they didn't get help for what they needed. And maybe they just were having a bad day. There's been too many instances for persons to sit in the emergency room because of mental health issues, because of our places being closed or not enough funding or whatever. And then they're pushed aside. That's not right. Mental health, we got to bring that back and bring the funding in for that. I could go on for hours. I would love to answer questions. I would love to hear questions from anyone about any subject whatsoever, as I am an open book and will answer to the best of my ability. If I don't feel comfortable answering the question, I'll let you know. But I would like to hear from others on some things that they are wondering about. Thank you.
Thank you, Terry. And with that lead in, I think it is your opportunity while we have a few more minutes to ask any questions that you may have. There could be some in the chat as well, but I think we were going to try, if you want to unmute yourself and just ask a question, I think that will work. So let's see if we can try to make that happen.
Well, this is Chantel. I noticed in the chat there were some comments about modifications to apartments in particular, but there was also, I think both Terry and Brooke talked, and Cindy as well, about modifications to home and access that way. And I think Jennifer just kind of popped up, but Jennifer made a comment about property owners, landlords, not making those modifications, not allowing tenants to make those modifications. And Jennifer certainly can expand on that in a moment too. But this is really a fascinating subject to me, the actual intersection of the ableism and ageism. And I don't think I fully appreciated how they work together. And I read an article even that called it the shared stigma. And and you know, when you think about it, it's like, well, why are we reluctant to make those changes, not just to homes and apartments, but businesses as well? And I think there's a lot of support for the theory that it's because it reminds us of vulnerability and weakness and impairments and you know, air quotes, not being normal, which are things. I get the shared stigma point of that really is part of the fear. There's, in aging, there's the fear of death, but for many people, aging means impairment. It means disability. It means not being able to do the things that a quote unquote normal young person can do, which goes back to us valuing youth over age. So I'm wondering if there are any thoughts by the panelists or others about that stigma, if you will, that is shared between both, and you know, keeping in mind that you often have, or not often, I mean, you can have people who are older and also have a limitation, physical, mental, whatever it is. You know, are we facing a stigma here, and are we not addressing that stigma?
You are correct. We are not addressing the stigma. We have to have these uncomfortable conversations. And they are uncomfortable. They make a lot of people uncomfortable. But we need to have them. We have to have them. And not only have them, change them, do action. Step forward.
And that's one of the issues, right? When, I mean, think about it. When you go into a house, let's say you're buying a house and you go in and there are handrails in the shower, you know, there are wider, maybe wider doors aren't a great example because now everybody seems to think open is great, but handrails and other modifications, people tend to get rid of those things or to disguise those things or to consider they're something that has to be fixed before that house can be sold, before it's desirable, because we walk in and we see those things, and what, you know, in our minds we think, you know, that's I don't know another word for it.
Well, actually, you know, it actually, as being as a person with a mobility challenge, I have a mobility challenge. So say I have friends, family, or whatever that live in an apartment complex, a condo, whatever, on the third floor, and there's no elevator. I can't go visit my family. I can't spend time with them. You know, I think a lot of rental properties and things like that as management would be very, very pleased to maybe invest a little money into AKA the grab bars, the openness, the open doorways and that. Because once you get a tenant in there that needs those, they're staying. They're not leaving because they don't exist out there. They just don't. And they need to. And it's not that big of a deal. It really isn't. Think of yourself as a mom with a kid in a stroller. You know, a wide doorway would help you. Rocker switches for a light. Just, I mean, it's just a different way of getting around and whatever, but it brings so much value. And I do have friends that are realtors that say anything that is modified or so-called handicap accessible does not stay on the market very long. They scoop them up because they're pretty much non-existent. Thanks.
Chantel, I was just going to add that yes, the answer to your question is yes, the stigma still exists. There's still an assumption out there that people with disabilities need to be fixed, or we don't like seeing older Iowans or people with disabilities because it kind of reminds us of being uncomfortable or those fears of having the same disability or the same diagnoses or just getting older is a weakness, as you said. And it's reflected all throughout our community. Think about how many times someone has met with their physician or an advocate, or just having a conversation with someone, and they have another person there with them. Look who the person talks to. They're not always addressing the individual with the disability. They're talking to the caregiver. Or we speak in childlike voices to someone with a disability versus just using our regular voice. We use phrases, colloquial phrases, or, you know, the things that we say, she's so crazy, that's so lame. When I was growing up in the 80s, everything was retarded. All those words are used in a derogatory sense because we're always trying to put down that group of people. And so I think we need to work really hard as a society to start changing our language and our behaviors to have a collective acceptance of who we are, instead of always segregating out what we don't like to see.
Which is something that, you know, I think we see still quite often when it comes to long-term care facilities in particular is, you know, the fancy glossy brochures that show the very active super ager, if you will, you know, walking around the grounds, and you don't see a lot of pictures of people in those facilities using a walker, using a wheelchair, anything else. It tends to be my word here, the super ager, the 80-year-old who we like to tell stories about how, you know, she just ran a marathon at 80 years old and has another one planned for next year. So I think it really runs the gamut, right? And we still in the year 2020 try to hide people we view to have impairments or to be weak or whatever your word is. And Jennifer, I see you disappeared on here. You think you had something to add.
Yeah, thanks, Chantal. I was really just going to ask, and I think it ties into what Cindy was just talking about, you know, with folks like directing questions or conversation to the caregiver or whoever's, you know, maybe accompanying a person with a disability or an older adult. Just kind of curious what the panelists' thoughts are on cognitive impairments from, you know, from whatever source or background, or the perception of cognitive impairments for folks who have, you know, maybe a physical disability or a sensory impairment, but are, you know, rightly or wrongly perceived to also have a cognitive impairment, and just what kinds of accommodations or access to service issues come up in those situations. You know, and I think what Cindy was mentioning, the reliance on, oh, well, clearly we need to be directing things to someone else, not this individual, you know, is one that comes up. But I'm curious if there are other things that folks have seen or experienced.
For myself personally, when my soulmate Jeff and I go out to eat, it's always everything is directed at him. How many in your party? Even though I could be the one that's wheeling in first and talking to the person, I'm being looked over. Or what would she like to eat? Or does she need some help? You know, really seriously, I know that some people are very cruel and do it intentionally. Most don't. And most really don't realize something that they may have even done. For instance, as I said, I have a 37-year radio broadcasting career. Now on radio, you don't see me, but you hear me, you hear my voice. And I ran into a listener that the first thing out of their mouth was, I didn't realize you were in a wheelchair. And my first response was, do people in wheelchairs talk differently? Is this something new? Or I'm so glad you came out tonight to, it's good to see you out. Of course you're going to see me out. Now, if your place is not accessible and hard to get into, no, you're not going to see me out because I can't get in. I can't enjoy my life like an able-bodied person can. It's demeaning. Less than. No one is less than. No one.
I would also add, you're going to see different situations where people with disabilities maybe are not understood, or their communication is restricted unintentionally. I can think of a training video I saw once that involved police and interactions with people with disabilities. If you're someone who is deaf or hard of hearing and you communicate through American Sign Language or some form of sign language, if your hands are handcuffed behind your back, you've just lost your way to communicate. We've also heard stories where maybe someone with cerebral palsy was pulled over and it's misinterpreted that they're drunk. Those type of things. In the area of guardianship, we see a lot of times where someone's always speaking on behalf of someone else versus letting the person with disabilities voice come through. There's a lot of assumptions made of they can't do this, they can't do that. Let's just take sexual activity, for example. I think we always think everyone with a disability is asexual. So we don't talk about STDs or we don't talk about how to protect yourself. But I always think of my grandpa. When my grandmother passed away, they lived in a retirement community, and my grandpa talked about all the little ladies bringing casseroles over to the house and suggesting that they were available. And I immediately was like, oh my gosh, like we are not talking about this. But when you think about it, we should be talking about it with our family members and with our older adults, because they're just as vulnerable to sexual transmitted diseases as everybody else. So I think I can go on and on. There's lots of situations throughout life where, we make a lot of assumptions, and we should stop doing that.
Well, it appears our time is coming to a close. First of all, I'd really like to thank all of you who took the time out today to participate in this webinar. Again, I'd like to thank the Attorney General's office for this opportunity. I would like to thank our interpreters. And Tara, I mispronounced your name, so I'm sorry at the beginning of the session. But thank you very much for interpreting today. And finally, I'd very much like to thank our panelists for their wealth of information and the testimonials that we heard today as well. So with that, I will hand it over to Chantel for any closing comments.
Yes, thank all of you so much for being here with us today, the panelists, interpreters. Jill is our moderator. You give your time to not only do this, but to prepare for it as well. And we appreciate that. And we appreciate having this opportunity to learn and have frank, open discussions about these issues. I posted in the chat that we will be getting the links out to you for the 3 recorded webinars that we have. That will include the chats. Some of our webinars have had some really good resources in the chat, so those will be included as well. We're working on that YouTube channel. Don't forget, we have one more webinar coming up. That's in November. I can't think of the date off the top of my head, we will be getting information out to you on that as we have with these others. Again, thank you all for being here. And I wanted to point out as well, I appreciate Jill's thank you to me earlier for putting this together, but I also wanted to again mention Jody Selby, Jody Allen, Brittany Shin, Megan Gilligan, Naomi Meinert, Casey Barrow, all worked together to come up with this idea of discussing these issues and having these topics, and their work, without their work, this wouldn't have happened. So thank you to all of them. And I hope that all of you have a great day. And if there are more questions or comments, please let us know. We can always hook you up with the panelists as well. They are great at answering questions and being available. So thank you, everyone. Have a great day. Unless there's something anybody wants to raise before we close, we'll end it here. Have a great day. Have a great weekend, all of you. Thank you.